Elmi, it's lovely to meet you. I look forward to hearing a little bit more about your story. So start us off with that.
Ek woon in Hermanus met my gesinnetjie. Ek het 4 kinders. Ek spandeer baie tyd buite. So ek sukkel met 'n droë vel. Ek sukkel met plooie natuurlik en sonvlekke.
Tell me a little bit more about your day-to-day skincare routine.
Ek het 'n routine wat ek aan my vel kyk, so ek was so mooi elke dag en sit my roompies op en my sonroompie.
Okay, so you're noticing the skin dryness is quite significant, and that in itself is nothing unusual for women in that sort of age category. Now, I'm speaking just of women at this point in time because, of course, we have hormonal fluctuations and changes. Of course, not close to the menopause just yet, but you'll find that a lot of women start complaining of dryness of their skin as they're getting a bit older. The top layer of your skin acts as a barrier, and it stops water escaping out into the environment. But what happens is that top lipid bilayer gets destroyed. And so your skin is effectively losing water out into the environment. So when we apply these rich moisturizers to try and feel more comfortable, we end up trying to put a thick layer on top, and hopefully that traps the water. Why don't we just replace the lipid? Instead of putting stuff on top, put new lipid inside. Other signs that you're seeing on your skin. I think what's important given your age is that we need to get quite aggressive in trying to fix that barrier very, very quickly. The lipid bilayer is something we can replace very easily. But what we want to do is we want to deliver with that those ingredients to try and help with pigmentation and with the wrinkles cells. In terms of professional skincare treatments, have you had any professional treatments on your skin before?
I've done the dermapen, IBL.
Lasers and lights. Okay, so you've had quite a bit. That's fantastic.
It, yeah. Yes.
Very, very good. Okay, because a lot of people are quite nervous about professional treatments to try and encourage skin growth, and I think that would explain why your skin is looking as good as it is. So right now, the approach for you is actually your barrier. So with the professional treatments that you've had, the needling, the lasers and the lights, they bring about a very significant improvement in the actual bottom layer of the skin, where the collagen and the elastin is. What we now need to do is fix that lipid bilayer. So at this point, I think what's key for you, other than very important sunscreen protection, and I haven't actually directly asked you about that, but outside of that is fixing barrier, antioxidants, and continue with the professional treatments that you're doing. Now, I spoke about sunscreen. Tell me, how are you using your sunscreen?
I use my sunscreen every day.
And that's something that I think I really want to stress is probably one of the best things you can do in your program, and I really commend you for having done that. The key here is the barrier and also the frequency with which you use antioxidants. It's probably the only element that you need to consider because of your outdoor lifestyle. Are there any other concerns you have that maybe we haven't addressed yet?
Los vel, loose skin, soos die...
A large reason as to why we start seeing sagging is because underneath our skin, up against the actual skeleton of our face, our fat pads get narrower, smaller, and they collapse down. So if the skin collapses down, because you've lost the fat pad, where does the skin go? Down. Then restoring volume can be done surgically or with injections, etc. Is there anything you can apply topically to prevent that? You can keep the skin structure healthy when you're younger. If you already have the sagging, you can make the skin firmer, but to actually tighten and pull up that skin with a topical preparation is not going to happen. Elmi, it was wonderful to catch up with you. I hope that the insights I've given you will help you down the line, and I certainly am looking forward to hearing more about your response to treatment.
Baie dankie dokter, dit is wonderlik om hier te wees en verskriklik insiggewend.